baby boomer bucket list. I'm Jennifer Whitney, and this boomer is getting a tattoo. Sky's the limit for baby boomers, all 75 million of us. Medical breakthroughs.
Cataract surgery is the most commonly performed operation in the United States and in the world.
And boomers are living longer, healthier lives. Baby boomers are boxing.
Forever young. That's the goal.
Boomers are rocking to old music and reinvigorating romance.
So what are we doing today?
I don't know, because I've never done this before.
We're redefining aging.
That, just the forever.
Just the forever with the squiggly line.
Yeah.
Boomers are bent on staying forever young.
All right, well, I'm gonna get started. I'm gonna do a little bitty line, let you feel it.
It's just annoying. It's not painful, it's just irritating. Irritating and annoying and painful. Okay, why is that part so sensitive?
It is closer to the bone.
Jeez, oh, yeah, it is.
I'm seeing the baby boomer generation coming in, getting a lot of really, really interesting pieces, pieces I'd never thought I'd see or I'd do on that generation.
I love it.
Boomers were born after World War II between 1946 and 1964. Growing up, we protested, rocked out, and busted through glass ceilings. Boomers, the me generation, want it all, and we've got bucket lists. But fulfilling our bucket lists can be threatened by a variety of age-related diseases.
EKG to the lobby, please. EKG to the lobby.
AFib, or atrial fibrillation, is an irregular heart rate that commonly sends boomers to the ER.
AFib happens to be the most common arrhythmia worldwide, and it affects about 6 million Americans. It significantly increases the risk of stroke by about at least a factor of 5 times. It promotes clot formation, so blood clot can form inside the heart, which can dislodge. And if it were to dislodge, unfortunately, it invariably ends up in the brain, and that can cause a major stroke in patients.
Aziza Davis Goins felt a strange sensation while at work on the East Coast.
Something was going on in my chest, and I couldn't figure out what it was. I went to the doctor and found out that I was in AFib. They rushed me out of the emergency room and they gave me all kinds of medication, and I was in the hospital for about 5 days. And I left there and literally flew home in AFib and got home and was rushed back into the hospital, and that's when I met Dr. Ariana.
And as a result of the aging patient population and the baby boomers especially, we are seeing essentially a major rise in diagnosis and incidence of the problem.
AFib interferes with blood flow. Blood can pool and lead to clots.
Dr. Ariana finally said, we need to do what's called an ablation.
Dr. Arash Ariana is a cardiac electrophysiologist.
We can be best described as being the electricians of the heart.
The procedure is state-of-the-art robotic surgery.
We're moving the mapping catheter all around the heart.
The catheter has an electrode at the tip and is inserted through a blood vessel in the groin. It senses the heart's electrical signals.
We call this catheter the lasso catheter. As you can see, it looks like a lasso, and we can advance it into the different structures inside the heart. This map is then used to guide the ablation.
The doctor creates ablation lesions at troubled spots using high-frequency energy.
Ablating, there we go.
Recent catheter ablation studies have shown very sort of promising outcomes in the range of 70–80%, even in some cases, of freedom from atrial fibrillation in the long run.
And I had that done in February of this year, and my heart's been fine ever since.
AFib symptoms include racing heart, palpitations, shortness of breath, and dizziness.
Perfect.
My lifestyle is active, and with the AFib and atrial flutter, your energy's down.
Genetics can play a factor, we now know, but lifestyle can also do the same. Things like high blood pressure, diabetes, caffeine especially can cause a trigger. Alcohol has been also linked directly to this disease process, so by changing the lifestyle and improving it, if you would, you can do a lot of good for yourself.